Good afternoon. My name is Paige Stringer. I'm the founder and the executive director of the Global Foundation for Children with Hearing Loss. I was born with a severe to profound hearing loss, and I'm a cochlear implant user as well as a hearing aid user. I feel very fortunate that I've been involved with the World Health Organization over the years in helping to raise awareness for the impact of hearing loss globally, including helping to lead the development of the communication strategy for the 2021 release of the WHO World Report on Hearing. I'm a member of the core advisory team for the WHO Resolution of World Report on Hearing Committee, and I'm a very proud founding member of KICA. I am pleased to have this opportunity today to provide an overview of the newly released World Report on Hearing. In 2017, the World Health Assembly adopted a resolution that encourages member states to include ear and hearing care within their national health plans. The WHO was tasked with producing a World Report on Hearing to provide evidence-based guidance on ear and hearing care and to recommend preventative actions and key interventions that countries should adopt. For the next 3 years, the WHO led the production of this report with the support of ear and hearing care professionals from all around the world. The first ever WHO World Report on Hearing released on March 3, 2021 as part of World Hearing Day. My presentation today will provide an overview of the report's elements and key messages. I hope this information provides helpful context for the CI advocacy efforts that we will be discussing later today. The World Report on Hearing starts off with some facts about hearing loss globally. Currently, 20% of the population lives with some degree of hearing loss. And without addressing this trend, this proportion could rise to nearly 25% in just 3 decades. Translated into numbers, there are over 1.5 billion people living with hearing loss today, of which 430 million experience hearing loss that is moderate or higher in severity. And this is also termed as disabling hearing loss. They need rehabilitative services to ensure optimal functioning. And this number is likely to grow to over 700 million by 2050. Among those with disabling hearing loss, the vast majority live in low and middle income countries of the world where services and resources for ear and hearing care are lacking. For instance, as this graph shows here, there is a gap of over 85% in low and middle income countries between those who need hearing aids and those who have them. The gap between need and access is likely even higher for cochlear implants. The report touches on the many impacts of unaddressed hearing loss on those affected, their families, and the society at large. For instance, in children, it hampers the development of their speech and language and is associated with delayed cognitive development. In adults, it leads to cognitive decline and social isolation. At a societal level, the lack of ear and hearing care services is very costly to society. Annually, $980 billion US globally are lost, mainly due to the worldwide loss of productivity and social isolation. So the next section of the report stresses the importance of accessibility to ear and hearing care across the entire life course, from birth to old age. It explains that achieving that vision requires a strong and coordinated action. There needs to be measures in place to prevent hearing loss at the population level, ensure early identification of hearing loss at all ages, and provide timely and appropriate care for all those in need. The report goes on to explain in detail how each of these measures can be achieved. For instance, many of the causes that lead to hearing loss are preventable. In children, 60% of hearing loss is attributed to issues such as rubella, low birth weight, birth complication, meningitis, ear infection, etc. Later in life, protecting ears from loud sound, avoiding ototoxic medicine, and maintaining healthy lifestyle choices can prevent the occurrence or progression of hearing loss. All of these can be prevented through available public health measures. Secondly, the report advocates for early identification through systematic screening of newborns, school-age children, and in older adults. It is possible to identify hearing loss at all stages of life in all settings. Such efforts, when supported by telemedicine, can assure quality care for all. Finally, the report stresses that once hearing loss is identified, it can be effectively addressed through a holistic approach that includes the provision of hearing technology, such as cochlear implant, along with rehabilitative therapy. Such support needs to be made more accessible to more people around the world. The next section of the report addresses the fact that global health systems do not currently have the capacity to meet the volume of ear and hearing care needs, mainly due to the lack of human resources, policies, finances, and technology. There is just a persistent lack of awareness about hearing loss among policymakers and even healthcare professionals. And these problems are further magnified by the stigma associated with hearing problems. The good news is that these challenges can be addressed, and the World Report on Hearing includes numerous examples of how innovative and evidence-based strategies are being applied the world over to respond to the gaps in care. The World Report on Hearing recommends that countries adopt an integrated, people-centered approach to ear and hearing care, implemented through a strengthened health system, so that all people can have equal access to the quality care that they require. It proposes a package of evidence-based intervention, acronymized as HEARING. And you can read through here what HEARING stands for. So the H is for hearing screening and intervention. The E is for ear disease prevention and management. A, access to technologies. R, rehabilitation services. I, improved communication, which includes captioning and sign language interpreters. N is noise reduction, and G is greater community engagement. So countries need to determine which interventions best suit their needs and situation and act on them. However, ensuring access to the prioritized interventions and services require action at all levels of the public health system. So this includes developing policy, building human resource capacity through education and training, procuring hearing technologies, ensuring financial and social protection, as well as setting targets and indicators for ear and hearing care. The World Report on Hearing ends with a call for action among member states to achieve global targets of 20% relative increase in ear and hearing care coverage by 2030. 2 of the 3 measures relate to cochlear implant. You'll see the first one is 20% relative increase in the effective coverage of newborn hearing screening services. And the second, that there will be a 20% relative increase in the effective coverage of adults with hearing loss that use hearing technology, including cochlear implants. So in summary, the key takeaways from the report are: 1, that the growing number of people with unaddressed hearing loss and ear diseases is unacceptable. 2, that urgent action is needed to prevent and address hearing loss across the life course. 3, investment is required in cost-effective interventions, which will, on one hand, benefit people with hearing loss, and on the other, will bring financial gain to society. And four, countries must act now to integrate people-centered ear and hearing care within national health plans for universal health coverage. So if you're interested to learn more, the World Report on Hearing is available for free download on the WHO website. Thank you so much for listening.